and took her to the emergency room. And we got her to the front door, and they said, "That's as far as you can go." And that was pretty much goodbye.
Thousands of Marylanders dying in hospitals alone. Families forced out of waiting rooms and told to say goodbye over the phone. The final toll of the coronavirus pandemic on Marylanders is yet to be seen.
We're just the sickest of the sick. It really felt like being there for people mattered.
Those loved ones cared for in their final hours by ICU nurses, risking their own lives for strangers. How the front lines have changed in a year, and the hope a long-awaited vaccine is giving medical workers. But we also witnessed emotional moments like these. Patients released from the hospital after weeks of isolation in rooms alone. Join us for the next hour as we share stories of suffering, survival, and hope. The pandemic, 1 year later, a journey from pain to promise.
Good evening. I'm Deborah Weiner, and thank you for joining us.
And I'm Stan Stovall. You know, it's very hard to believe it's been a year already since the World Health Organization declared coronavirus a pandemic. And while the past year has been extremely difficult on everyone, vaccines do now offer hope.
Over the next hour, you won't hear from a lot of officials talking about what you have already heard. Our goal is to bring you personal stories of loss, yes, but more importantly, hope for a new, safe, and healthy tomorrow.
Yeah, we begin with I-Team lead investigative reporter Jane Miller. She shows us where we stand right now, the ongoing struggles, and she offers a glimpse of what the future may look like.
None of us could have imagined a year ago we were about to begin a long journey like nothing else in our lifetimes, locked into our homes, thrown out of work, sickened, and made to endure terrible loss. Keonti Harpole, also known as Tiki, died April 8, 2020. She was 51. But for coronavirus, her husband says, she'd likely be with us today.
My wife was the picture of health, not sick, not ailing, nothing that we were fighting or dealing with. If not for that.
Tiki was in the first wave of coronavirus death in Maryland when testing was scarce and medicine unfamiliar with this new respiratory virus.
She went to the doctor, she went to the hospital. They said, "Oh, you got pneumonia." They gave her antibiotics and said, "Go home, come back in a week."
Her condition worsening. Adrienne Harpole took Tiki to the emergency room. She would never leave the hospital.
We donned masks and gloves and took her in the car, made her sit in the back seat, which I know was, painful, and took her to the emergency room. And we got her to the front door, and they said, "That's as far as you can go." And that was pretty much goodbye at that point.
As of Friday, March 12, 2021, 7,848 people have died in Maryland from coronavirus-related illness. 88% were 60 years or older. Based on 2019 statistics, coronavirus would be the third leading cause of death behind heart disease and cancer.
But in the U.S., more than 500,000 people have died from the pandemic, and more than 28 million cases have been reported. And that's obviously an enormous tragedy, one of the worst public health disasters on record. And so I think when we take a step back and think about where we are and what we've all suffered over the last year, it's really striking.
Right now, new coronavirus cases average 831 per day, a sharp drop from the 3,019 average cases per day in mid-January. This week, Maryland joined some other states in lifting some coronavirus restrictions. Public health experts caution, don't rush it.
I am expecting that in the spring, we will continue to need to push down case counts. Right now, our caseloads are around 20 cases per 100,000 per day. That's how epidemiologists think about it in the U.S. And I would like us to get below 10 as a goal, and preferably even lower.
Keeps the food warm.
The economic impact of the pandemic has been harsh and may last several years. Donald Ross has been able to keep his catering business going only by pivoting to a meal delivery business.
Hey,
Hello.
right on time.
You'd be surprised how many people, single families, that are in need of cooked meals, healthy cooked meals, delivered to their homes on a daily basis. So I've been doing a 3-day, 4-day, and 5-day meal prep plan, which has just kind of taken off, and it kind of supplemented our income because all of my catering events have been canceled going into this year.
Donald's wife, Lakia, is also a small business owner. Like so many other retail and personal services businesses, she had to shut down last March. She reopened in May to limited capacity rules that continue.
You make enough to pay the bills, but we used to a normal rotation where you doing more than 8 people a day, where you doing up to 15 people. You know, the income was cut drastically, but long as we still can work, I'm fine.
In December 2019, Maryland reported nearly 2.8 million jobs. In December 2020, the state reported about 2.6 million jobs, 124,700 jobs lost to the pandemic.
I was a medical auditor.
Amanda Edwards has been out of work for almost a full year. Like so many others, she's now battling with the state's unemployment system to collect benefits. Her next job uncertain.
It's just been a huge struggle. I don't know what to do. You know what I mean? Everybody says, like, go for assistance and help and all that stuff, but you can't get in touch with nobody. It's because everybody, I think, is trying to get help now with the economy, with everything going on.
The pandemic has exposed another layer of racial disparity. Black people make up 31% of the state's population. They represent 34.3% of COVID deaths. And the gap is wide in vaccinations. To date, 62.6% of people in Maryland fully vaccinated are white, 15.5% are black.
You try to look forward.
Adrian Harpole, 11 months after the death of his wife, is now working on a campaign to urge black people to get vaccinated.
I've got a dozen friends who've lost their parents doing this. One of my very best friends is in Arkansas right now. His mother's funeral was yesterday. Another guy was working with me on this project. And in the midst of the project, his son died last Thursday. They buried him Saturday.
So what do the next few months look like? Dr. Rivers from the Johns Hopkins Center for Health Security told me she thinks case numbers will improve through the spring and summer. She's a little bit concerned about the fall due to the variants of the virus now circulating. I'm Jane Miller, WBAL TV 11 News.
Jane, thank you. As the pandemic crippled our nation's healthcare system, health professionals stood firm on the front lines fighting this invisible war. And with war, sadly, came heartache for thousands of Marylanders as many patients spent their last moments not surrounded by family, but by very compassionate doctors and nurses. 11 News reporter Trey Ward sat down with a frontline nurse to talk about what he's experienced over the past year.
For the last 14 years, nurse Andrew Rowlingson has worked here at the University of Maryland St. Joseph Medical Center as a bedside nurse. But it was the past year where his job would be challenged.
Knowing that their families were hours and hours away and they were just the sickest of the sick. It really felt like being there for people mattered.
In the grips of the pandemic,
we all saw New York. And as frontline healthcare workers, I mean, we were afraid.
Like soldiers at war, fighting this fatal virus on the front lines, are health professionals like Nurse Andrew Rowlingson working to keep patients stricken with COVID-19 alive.
You know, with COVID hitting and everything shutting down and not being able to have visitors, you really kind of felt that loneliness that patients can go through here.
Nurse Rowlingson spent his nearly 14-year career at St. Joseph Medical Center.
Well, I really connected with the bedside and was just really inspired by the patients and the work that you do, because it really matters.
Where we met inside the Zen Garden.
Just literally a space for staff, family, patients even.
Its namesake.
This has actually been a pretty great space for everybody.
Helping not only patients, but staff get through some dark times.
Even through COVID, this has been a little bit of an escape through all of that to be out here. But we've brought a handful of patients down here, certainly from the critical care unit. We've brought them down here, and it's really kind of turned turned the course of their recoveries around.
But he says there were times when recovery wasn't an option. As the past year, in the face of the coronavirus, Rowlingson saw death over.
Some of the patients that came up to us were so sick that you couldn't even talk to the patient.
And over.
Within hours of them arriving, you just knew that they weren't going to make it.
And over.
Making that phone call to to a family that you've never met, to let them know you've made it here, but your loved one's not going to make it. It's a hard conversation.
But where there was once sadness in the hallways, now lives optimism.
This is the first day that we have no patients with COVID in our ICU, which is pretty great.
After a year-long battle fighting to defeat this invisible opponent.
There was a lot of talk early on with this of saying, no one asked for this. This isn't what nurses signed up for. This isn't what doctors signed up for, anybody. But it was what was handed to us, and I've been so inspired by just the sheer resolve of the people in this industry who have stood up, sacrificed so much.
A heroic sacrifice, standing up against an ever-changing disease to keep countless people living another day.
That's one of the things that's most impressed me about this industry has been the resilience, just the sheer power of the people to make things work, to overcome all of these obstacles that we faced, all of these challenges, to just not relent at solving these problems and trying to overcome.
Reporting from Towson, I'm Trey Ward.
It's been pretty impressive.
WBAL TV 11 News.